Hello, doctors. So today I'm going to talk about Simman station. So Simman is a station, like it is one of the most feared stations among the candidates, but actually Simman is the most, like it is the easiest station that you can encounter in prep to exam, because your only goal here is to keep the patient alive, and you can keep the patient alive very easily here. Okay, and if you're at the end of the station, if your patient is alive, it means that you have passed the station. Okay, so what basically a Simman is actually a dummy that is simulating a main. That's why it is called Simman. And so let me show you how a Simman usually looks like. So this is how a Simman will look in the exam. It either be a Simman or a Simwoman, and it talks to you, it replies to you. Basically, now the Simman is replying, someone else is replying. It is either it's not a recorded sound. I don't know, they have connected a system or something, but it talks to you. Okay. All right. So Simman is connected to this monitor here, and one monitor will be placed on the side of the Simman, and it will be showing its vital signs. That is its blood pressure, oxygen saturation, respiratory rate, heart rate, and temperature. So as in Simman stations, they are usually giving you some emergency situation. Okay, so you will find some problem in one of the 4 vital signs. Okay, and your aim is to stabilize the finding on the monitor, stabilize the patient and stabilize the findings on the monitor. Okay, so there are some general principles for the Simman stations. The first one is, as you know that as soon as you enter the cubicle, you need to verbalize your name and GMC number for the examiner. So when you enter the station and you verbalize your name and GMC number for the examiner, after they move toward this Simman here, okay. But before going near the Simman, look at the monitor. Okay, have a look at the monitor. And you need to do some acting here as well. Like while looking at the monitor, you need to completely turn your head towards it. Okay, so that the examiner knows that you are looking at the monitor, that you are aware that this is an emergency situation and you are looking at the patient's vitals. Okay, so you look at the patient, you look at the monitor, and then you move toward the patient really close, and you don't be scared of the Simman, move really close toward it and talk to it. Okay, so one of the mistakes that some candidates do is they start talking to the examiner, or they stop talking to looking here and there, and then they start talking. So what you need to do is you need to treat this Simman as a normal living patient. Okay, so you need to look at his face and you need to talk to this person. All right. So this is one thing. Other important thing is that you need to talk loudly in the station. Okay. So I keep your tone loud, but this does not mean that you should be rushing. You should be calm and composed. You should talk slowly, but in a loud tone. Okay. So normally what we do while we do our introduction, we say that, hello, my name is Dr. X. I'm one of the junior doctors here. Can I confirm your name and age, please? This is what our tone and our way of introduction is in a normal non-emergency situation. But as we know that this is an emergency, you need to say that, hello, I'm Dr. This, one of the junior doctors here. Is it Martha? Okay, just memorize name of the patient outside the cubicle and confirm it. Don't go slowly. Can you confirm your name? Can you confirm your age? Nice to meet you, and this and that. Okay, just go loudly. Hello, my name is Dr. X. One of the junior doctors here. Is it Martha? And then the patient will be telling the doctor, I can't breathe. Doctor, I'm in a lot of pain. Doctor, I'm feeling dizzy. Something like this, or the patient may not respond back at all. Okay, because there are some emergency situations where the patient is unconscious, for example, hypoglycemia. So the patient will not respond when you ask his name. So you go is it Mr. Smith? And then Mr. Smith will be lying there, not responding to you, okay? Then you touch the patient and say, and go like, Mr. Smith, but if Mr. Smith still does not respond, then there will be a band around his wrist. So you need to have a look at the band. Again, clearly have a look at the band. Turn your head towards it, okay? So that the examiner can so the examiner knows that you are confirming the patient's name. All right. So this is how we go with the introduction, loud modes, and memorize the patient name, just confirm it there. Is it Martha? Is it Simman? Is it Olivia? And the patient will go like, yes, doctor, but I'm in a lot of pain. And this. So when the patient says this, tell him that, yes, Samantha, I'm here to help you. Okay. Can you please tell me what's going on with you? And you'll be like, yes, I'm in a lot of pain. I can't breathe. Okay. So after this, you know what are the if you have like already looked at the monitor while moving towards the patient, you already know where the abnormality lies in his vital signs. And we all know about being doctors, we all know about the ABCDE approach, okay? So we all know about this ABCDE approach. So where A stands for airway, B stands for breathing, C stands for circulation, D for visibility, and E for exposure. Okay. So when you look at the monitor and you find that there is some abnormality with the oxygen saturation, then you tell the patient that, yes, Samantha, I can see that your oxygen saturation is a bit on the lower side. So I need to give you some oxygen. Can you please tell me if you have any smoker's cough? Okay. So the patient will be either responding with yes or no. Okay, so the patient says, no, I don't have smoker's cough, then we need to give the patient 100% oxygen with a non-rebreather mask. And if he has smoker's cough with a COPD, then we need to give the patient oxygen, 28% oxygen with a ventilator mask. Okay, so you need to verbalize state for the examiner that I'm going to give my patient 100% oxygen with a non-rebreather mask at 15 liters per minute. Okay, and then you move towards you start the patient, you put the pick the mask from the medicine cart. So there will be a medicine cart here. You'll pick the mask from the medicine cart and you'll put it around the patient nose and mouth. Okay, so you are done with the airway part here. Then you will move toward the breathing part. Okay, so for the breathing part, you will ask the patient that I need to have a look at your chest, please. And you will remove the cover from here, have a look at the chest, that is inspection, then move toward palpation, and do auscultation, percussion, and then auscultation. Okay, so that is the B part. So if there is any abnormality in the B part, then you need to correct it. And we'll be talking about how to correct the specific abnormality in every specific part and the Simman stations. So there are some about 9 to 10 Simman stations, and we'll be discussing the management of each of them one by one. Okay, so once you are done with the B part, then you move towards the C part. And then first of all, you touch the patient's hand and you say that I'm looking for cold peripheries. Okay, then you need to check capillary refill, like pressing our patient's nail and look for capillary refill here. Okay, then you move toward his pulse. So you check his radial pulse and then it comes through the patient arm. Okay, so when you come here, you do not need to check the patient blood pressure manually, because there will be a blood pressure cuff connected to the monitor. So when you come here, you will say that, you know, I need a fresh blood pressure monitoring. A fresh blood pressure reading. So you verbalize that I need a fresh blood pressure reading, and then look at the monitor. So the monitor will give you blood pressure reading. Okay, so if there is any abnormality in the blood pressure is on the lower side, then you need to verbalize state, and you need to correct it by giving fluids. So you will pick the fluids from this medicine cart and you will like hang the fluid on the IV stain and then proceed with it. Okay, but if there is any abnormality, if you look at the monitor while entering the room and you find that oxygen saturation is normal, okay, respiratory rate is normal, but there is blood pressure which is low, like 80/40, then you do not need to start from the airway or breathing. You will straight away start from the circulation part, correct the circulation part, and then move again towards airway and breathing. Okay. All right. After circulation, there is disability part. So first of all, in the disability part, we will check the patient's blood sugar level. So glucometer will be there in the medicine cart. You will pick the glucometer and you will bring it here. So the examiner will tell you that the blood pressure, the blood sugar level is, for example, 4 millimole or 3 millimole. Okay. So you do not need to actually check the blood sugar level, but you will pretend that you are checking and the examiner will give you the findings, okay? Like you need to pretend that you are giving the medications. You need to pretend that you are giving fluids, okay? What some candidates do is they say that, you know, I'm going to give my patients 500 ml of normal saline, and then they like keep standing here and look at the examiner to say assumed. Okay, the examiner will never say assume until you go towards the medicine cart and actually pick up the medication and pretend giving it to the patient. Okay. All right. So the examiner tells you blood sugar level. If the blood sugar level is low, then you will verbalize that I need to give my patient glucose. Okay. Or the specific glucose concentration and mLs that we need to give the patient. I'll be talking about that in the hypoglycemia station. Okay, today I'm just talking about like generally how to approach a simple station. Okay, so you will correct the glucose level and then you will check again. All right, so the first part is to check the glucose level in the disability part. Okay, after you have checked the glucose level, you need to go, you need to pick up a torch and tell the patient that Samantha, I wish shining some light in your eyes. It might be uncomfortable, but please bear with me. And you check for pupillary reflex, okay? And then you ask the patient that, can you please raise your right hand for me? Okay, so that is your disability part. After disability part, you need to do exposure, all right? Exposure of the patient, and in this part, you need to tell the patient that, you know, I'm going to have a look at you generally. For that, I need to expose you further to look for any abnormality, okay? So there you are done with A, B, C, D, and E. And after that, after you are done with it, if you are still left with time, then take a brief history of the presenting complaint. Like if he is short of breath, take a history of pain. If he is dizzy, take a short history of pain. But in history as well, you need to be very like this is an emergency case, so you do not need to ask about lifestyle questions and all. You just need to ask about the presenting complaint, like when did it start, how did it start, has this happened before, do you have any medical condition, and do you have any allergies? Okay, so only the most important things. Okay, and then you will say that, you know, I'm going to call my seniors and they will come and have a look at you and we are going to admit you today. Okay, so admission, if not already admitted, and calling seniors. These two things go for all the stations. Okay. All right. So after this, we'll be discussing all the Simman stations and their management in detail, one by one. Okay. Thank you for listening to me, and I wish you good luck for the